everyone, and welcome to the 2021 Kickoff celebration for Making Strides Against Breast Cancer of Seattle. My name is Aubrey, and I'm your local staff partner. I'm so excited to be coming to you today right here from beautiful Gasworks Park, home of our 2021 Seattle Strides event. We can't wait to see all of you right here this October. This evening, you'll hear from some of our amazing participants, our incredible volunteer leadership team, and our sponsors. You'll also learn about the important work that's being done right here in Washington State for the American Cancer Society. After a very long year in 2020 and not being able to assemble in person, we are beyond thrilled to see all of you right here at Gasworks Park on Saturday, October the 16th. Our event would not be possible without the time, dedication, and passion of our incredible Seattle Strides volunteer leadership team. Please join me in thanking these amazing individuals for all of their hard work. We hope this evening will inspire you to join us in October for Making Strides and help us save lives, celebrate lives, and lead the fight for a world without cancer. Thank you for joining us.
Hi, I'm Susan Grassdahl, and I am here today to share with you why I am involved in Making Strides Against Breast Cancer in Seattle. I have been volunteering within the breast cancer community for many years, and this is because approximately 40 years ago, my mother was diagnosed with breast cancer. I was working downtown at the time, and my mother came in to see me at work, which is something she never does. She'd been up on Capitol Hill at Group Health and had just been diagnosed with breast cancer. And this was pre-cell phones, and I was the closest one to her that she could come talk to. I could see the fear in her eyes, I could see the confusion, and all I heard was cancer. And I didn't know what that meant. I just knew it wasn't good. And that moment has stayed imprinted in my mind for many, many years. Fortunately, my mom did survive the breast cancer, and didn't get a lot of help from me with that in support or anything. I didn't know what to do. I didn't know what resources were available. This was also pre-Google. I had no computer I could handily go to and look up information. And it was a scary time. Not knowing things is kind of frightening, but we managed somehow to get through it. And life went on. Life went on, and things happen. And around 2005 or so, I started hearing about, probably a little even before that, about this 3-day walk with Avon. They were doing a 3-day walk that raised money to help fight breast cancer. And it reminded me of that day that my mom came in and saw me, and I thought, well, that's kind of interesting. And I thought, I think I want to do that. And I reached out to a girlfriend of mine who said, oh my God, I was just gonna call you. I want to do that because a close family member of hers had just been diagnosed with breast cancer. So we did that, and one of the things I learned in that was that there was a community, and that there was a camaraderie, and that coming together with people that wanted to help with survivors and thrivers was really a powerful thing. So since that time, I've volunteered with a variety of nonprofits to help raise money, fundraising for much needed research, for the financial support that's needed, and to help that find research, to fund the research that's really needed. I continue to do this because throughout this time, since 2006, I've learned so much, and I've been able to get out and share that knowledge with others in community health fairs, with family, with people who call me because they go, hey, I've heard you know a little bit, do you know any resources? And today I know resources that I can pass on. In the past years, it's been a privilege to be a part of that and to advocate for more research, especially in metastatic breast cancer, and being able to support the thrivers who live with metastatic breast cancer. And that's one of the big reasons today that I continue to do this. I'm still very involved in advocating for research, for education. There's still a lot of women and men get breast cancer, that they don't know about it. They don't know what their healthcare rights are. They don't know what resources are available. And I also do this because of the health inequities for underserved women and men in our communities, and I want to see that improve. So there's a variety of reasons, and I think all of us here today have been touched by breast cancer in some way, and we all come with different reasons, and that's why I love to have these events where we can get together and celebrate our successes, to talk about what we want to do in the future, and to hold each other up, because many people come with losses as well. I kind of think that I can't cure breast cancer. Well, I know I can't. I don't kind of think that. I know I can't cure breast cancer. But what I can do is be that little pebble in the pond that creates a ripple effect. And I think if we all throw our little pebble in the pond, our ripple effect turns into a wave, and that turns into a tsunami of hope and research and being able to help others. I personally feel that the joy of living is in giving, and so this really gives me an opportunity to lead a more fulfilled life as well. I love American Cancer Society. I love their mission statement, which is to save lives, celebrate lives, and to lead the fight for a world without cancer. And that's definitely something that I can get behind and support. And lastly, I'm honored this year to be the event chair for Making Strides Against Breast Cancer in Seattle. And I just want to welcome you all to this event. I look so forward to October when I get to see you all, and we get to have a fun and successful event.
We walk for hope.
Hi everyone, my name is Amanda Peterson. I'm from Seattle, Washington, and I was diagnosed with invasive ductal carcinoma at age 32. My story to diagnosis and journey through treatment is unique, just like every cancer warrior. While 23 weeks pregnant with my first child, I received an irregular result to a common blood test used to detect early signs of development disorders. My husband and I had initially turned the test down when presented with the option, but later chose to have it as a way to help us prepare our home should it show our child had special needs. The day I received a phone call from my doctor, I knew something was wrong. The silence on the phone, asking about the weather, and the apology, it just wasn't normal. I was told the result came back cloudy, that my DNA was overtaking the test, and that there were signs of a tumor growing somewhere in my body. I spent the later part of my pregnancy completing multiple rounds of blood work, scans, and visiting with specialists. Everything was coming back clear. Nobody had any answers. We had plans to complete a mammogram before delivering my sweet baby girl, but a diagnosis of preeclampsia brought my daughter to my family 5 weeks early. We didn't know it at the time, but she would be the light and hope my family and I needed to get through the year in front of us. At my 6-week postpartum appointment, I had mentioned an ongoing struggle with trying to breastfeed. I would experience excruciating pain on the left side with every attempt. I was immediately sent to the Seattle Cancer Care Alliance, where I completed multiple mammograms, ultrasounds, and unexpected biopsies. 4 days following that appointment, my diagnosis was confirmed. Following my diagnosis, I completed 12 rounds of chemotherapy, had 2 surgeries, finished 33 rounds of radiation, and completed a year of immunotherapy infusions. I also looked after and cared for my newborn baby girl with an immense amount of help and support from family and friends. Early on in my journey, a very special lady and fellow warrior shared with me a saying that carried me through both my good and bad days. It was believe in better days. It sounds so simple, but it's what I needed to hear and my heart needed to be reminded of when fear, anger, and uncertainty crept in. Cancer is scary, and there are hard days, really hard days. Throughout my journey, I allowed myself to feel the emotions, to be mad, to feel sad, but what I didn't allow myself was the chance to stay down for long. Staying positive, focusing on the good around me, trusting my doctors, and continuing to have hope helped me every day. I know I'm one of the lucky ones. I count my blessings every day, and I've committed myself to helping this community with every chance I get. With all of the uncertainty around us today, I hope my story brings light to someone.
Everybody, this is Barb Killer, and I'm volunteer lead for this year's Making Strides Against Breast Cancer Walk, which is going to be at Gasworks Park on October the 16th in Seattle, Washington. Many hands are going to be needed to make this event successful, and I can't think of any better hands than your hands. We'd love to have you there. I'd love to have you volunteering. We need a lot of volunteers to come in. So we're looking forward to seeing you. Why do I volunteer? Well, I want to make an awareness of what's available, the research, the education, the services that are available through the American Cancer Society. And, I just want to be a part of the cure. How about you? So come on out and join us. We'd love to have you. And all I can say right now is just peace out, love you.
I am so excited to set up my Facebook fundraiser for my American Cancer Society fundraising team. Now let me just go to www.facebook.com.
Wait! Don't want to set up your Facebook fundraiser through Facebook. Do you already have an American Cancer Society account for the event that you're supporting?
I do.
Okay, can you go to the event website first?
Of course.
And
All right.
And then log into your account.
All right, I'm all logged in.
So click on that button that says dashboard.
Okay.
And do you see that button at the top that says connect to Facebook?
Oh yeah, right here.
Click that. Now, your dashboard is connected to your personal Facebook account, so any donations that you get through your Facebook fundraiser are going to immediately come to your team, and it's going to show up on the website for you.
So if I set it up through Facebook, those dollars wouldn't come to my fundraising team?
That's right.
All right, I'm glad you showed me the right way. Thank you.
Always happy to help.
Hi, I'm Roxanne Hellerin, coming to you from beautiful Lake Washington on Mercer Island. And I'm just so thankful to have Making Strides Against Breast Cancer have another walk this year in Seattle. I wanted to share with you, I learned that you never know how strong you are until strong is all you have to be. As a 7-year breast cancer survivor, I really learned that to be true. I'm so thankful for American Cancer and all the resources that they provided to me personally during my treatment. And I'm thankful that our community that I work on in Mercer Island is able to support American Cancer by having a walk at our own community. Thank you so much for supporting American Cancer, and I know that those who are going through treatment really appreciate your finances and your support, and we're just thankful to have you in Seattle.
Hi, I'm Kat.
And I'm Mary. We are the co-owners of the Bar Method Finney Ridge and are so excited to be the official fitness sponsors of the American Cancer Society's Making Strides event right here in Seattle.
The Bar Method is a bar-based fitness workout that uses isometric motions using your own body weight and small props to target and tone every muscle in your body. Our mission is to empower women and men to be the best versions of themselves. Our studio is women-owned and located in the heart of the Finney Ridge neighborhood. We hope you'll come and join us in studio for a free class. Otherwise, we can't wait to see you at the event.
Can't wait!
Hello community, my name is Christine and I am the Senior Program Manager for Washington and Alaska. My role as a senior program manager is to manage the logistics and patient programs, as well as support, recruit, and manage our program volunteers. I'm happy to share what we in program management are doing locally in your community. One program I would like to highlight is our Reach to Recovery program, which connects patients to trained breast cancer survivor volunteers. Through our Reach to Recovery programs, patients have access to online chat or phone conversation with trained volunteers who have survived breast cancer, so patients can talk to someone who knows what they're going through. Like many of our other patient programs, this program is completely free. Our newly launched reach.cancer.org website and mobile app makes it easier than ever for patients and survivors to connect and chat whenever, wherever. With this new virtual app, volunteers can not only be matched with patients in their local community, but patients nationwide as well. We know that Black women have a significantly higher death rate from breast cancer. As a result, we at ACS want to ensure that American Cancer Society is present and there for every community to help close the gap of health equity. Reach out and remind those inside and outside of your community the importance of prevention and early detection. My role is to help inform the community of our patient program, online tools, and 24/7 helpline. I want to stress that these programs are not only available just for patients, but caregivers as well. We at ACS are constantly updating our website and local resources, so be sure to visit cancer.org or call our 101 support helpline at 800-227-2345. Or feel free to reach out to your local ACS rep for more information on Reach to Recovery or our other patient programs. I want to send a huge thank you to all of you for all you do for attending events like these, raising funds, so that we at ACS can live out our mission to save lives, celebrate lives, and lead the fight for a world without cancer. Thank you.
No matter the color of your skin, where you live, who you love, or who loves you, anyone can get cancer. But it doesn't affect everyone the same way. It's unfair and unequal. Where you live shouldn't determine if you live, but all too often it does. Meet Jenny and Marianne, best friends since elementary school. They rode the same bus and loved the same dance moves. Years later, both were diagnosed with breast cancer. They were devastated by the news. But research suggests Jenny has a better chance of surviving. Black women are 40% more likely to die of breast cancer than white women. Where people live, work, grow, and learn can greatly impact their cancer experience too. Jenny lives in an area with access to quality health care, affordable healthy foods, and reliable transportation. For Marianne, it's a different story. Due to generations of unjust discrimination, her community has limited or no access to those options. Marianne, like so many others, won't have a fair and just opportunity to prevent, find, treat, or survive cancer. The statistics tell a harrowing story. African Americans have the highest death rate and shortest survival of any racial group in the U.S. for most cancers. The cancer-preventing HPV vaccination rates among youth are lower in rural areas than urban areas. And research shows the LGBTQ community is likely to face greater barriers to care, such as homophobia or transphobia, which can prevent early detection of diseases such as lung cancer. The list of disparities goes on and on. At the end of the day, access to quality care shouldn't be a privilege, it's a right. For Marianne, for Jenny, for all people. That's why the American Cancer Society is committed to advancing health equity. That includes access to cancer prevention, detection, treatment, and survivorship by addressing the social determinants of health. A mix of social, economic, cultural, environmental, and health systems factors historically linked to discrimination or exclusion. We're working tirelessly to provide the tools and resources based on need that allows everyone a fair chance to reach their full health potential. That means we're stepping up our commitment to health equity in our research priorities, programs, services, and advocacy. Health equity is what ACS and ACS Can believe in. Join us in advancing health equity and reducing cancer disparities.
I'm grateful to be here with you today. I have the pleasure of sharing with you the tremendous role the American Cancer Society has played in breast cancer research nationwide and here in Washington. Currently across the country, we're investing $71.5 million in breast cancer research. Those dollars are distributed over 153 breast cancer related projects, and nearly $1 million of those funds are being utilized right here in Washington. Over the years, our local funding has played a major role in breast cancer diagnosis and treatment, including the discovery of the BRCA1 gene, as well as CAR-T immunotherapy for metastatic breast cancer, as well as so many others. This research includes clinical research seeking new and better treatment options, research focused on the cause of breast cancer and where it comes from, so we can ultimately reduce the number of individuals diagnosed with breast cancer. We're also funding population science research, which leads to state-of-the-science data and enables entities to make better informed screening and lifestyle recommendations. Finally, we're active in health equity research. Here in Washington, through a partnership with Pfizer, we're currently funding a health disparities research project with the University of Washington Medicine, where providers aim to close the gap between mammography screening rates in Black and white women, as well as reducing their time from diagnosis to the beginning of their treatment. Washington State ranks number 44 in the country related to women being current with their mammography screening. In 2018, 63% of women aged 45 and over were up to date. And unfortunately, we know that that number is significantly lower today following the COVID-19 pandemic. The American Cancer Society remains vigilant to get screened. We cannot do this work alone. It's crucial to have our volunteers, our donors, our scientists, and our staff come together in this critical fight. Thank you for all you do and your continued support of the American Cancer Society.
So I am Liza, and I think this is my 10th year participating in Making Strides Against Breast Cancer. I was diagnosed 11 years ago almost, with my primary diagnosis and 9 years ago with metastatic disease. So what started out, I think, as a way just to find a community to support me on my initial diagnosis, and joining the Strides Walk that year, not knowing what I was getting into, just wanting something to hook into, has now turned into a 10-year journey, which means a lot more to me than I ever thought it would be, because it was just originally a walk, and then it became sort of a fundraising thing, and now actually I've learned, for me, it's more about my message and my story and encouraging people and giving hope and inspiration. So it's just grown into its own thing, and I really, really appreciate the American Cancer Society and this event and all that it's brought for me, from my initial diagnosis and the patient navigators and helping me feel good about how I looked in the beginning, and when I lost my hair, pointing me where I could find the wigs, and helping my kids find sources because they were all really young, and my spouse, to now being able to tell my story and reach out to people and hopefully give some inspiration. I was trying to think about why walk, and I obviously originally walked for myself and my family, but now I find myself walking for others, which was not really the initial thing that I thought I would be doing. But I reached out. One of my friends actually just texted me that I met through this whole journey, and she said when she's counseling other people, even on other that are having difficulties in other parts of life, she'll use my story to give them courage and inspiration to say that they can do it. And if my story can just reach one person, and then that story, their story reaches another person, I realize how far spread this can go, and how one effort can change a lot of lives just by giving inspiration. But so I guess that's really why I walk, is to give inspiration and hope that we can still live with this. As I can say that I've been living with metastatic cancer for 10 years, which most people 10 years ago didn't think would be possible, but I've lived through all the research updates that we help fund with the funds that we do this, and it's just really important. So that's why I walk for everybody.
Did you? Friend, I just had nothing to do today.
Oh, of course you did not.
Well, my dear
You're
friend.
terrible. You guys, that was nice.
Surprises are good. So I have something special for you.
What is this?
This is the American Cancer. It's an inspirational award to you. It's okay. And I wanted to share, this is for Making Strides and American Cancer, because we've known each other a long time, 7 years, I think that's long, and you've been walking this journey a lot longer before me, and you're still continuing to do it. We had no hair together, and now we have hair. And I just want to tell you, you are an inspiration to me.
Oh my God.
It's people like you that make this. Well, I have to tell you that no matter what we were doing, hair or no hair, this lady always had a smile, and your can-do attitude helped me to push forward through it also. And I know that you've been doing this a long time. I remember you telling me one of the first things we talked about was you had your baby. The last one, who is how old now?
11.
11. So it's been years and years, and nobody deserves to have to go through this as long as you have. But you look beautiful, and I want to thank you for being an inspiration for your fundraising team, your Liza Living Life. It's hard to get people to support you, and every year you're faithfully out there walking. And I know that you hit gold pace setter, which is a lot of money to raise. And we're just so blessed to have you as part of our team, and just as a sister who is doing what she needs to do to live life. And we were blessed to have you. Love you.
Thank you so much for spending this time with us this evening. We can't wait to see all of you this October. Join us today.